We're here for a healthier you.
Hey, we're back here today with our Vital Signs segment, and today we're visiting with Dr. David Grantham at Pinehurst Surgical. And Dr. Grantham is president of the clinic and also a general surgeon here. And I wanted to talk to you a little bit about the history of Pinehurst Surgical. It's been around for a while, so tell us what's going on with the history and what's new.
So we've been here almost 75 years, and the clinic actually started as a combined effort with 3 physicians, 3 surgeons, and they started seeing patients as a unique clinic in the hospital facility itself. And then a few years later, they involved their own building, and then we've been growing since.
All right, so speaking of growth, tell me how many different specialties are here and how many different providers are here. What can people expect when they pop onto your website and see all of that array of specialties? What are you looking at?
With almost 45 physicians in the building and multiple mid-level providers as well, we offer a wealth of services here. Anything from women's care to vascular, ENT, general surgery. We offer bariatric surgery, spine surgery, joint replacement, sports medicine, urology services. So we feel like we covered the gamut of surgical care.
I would
Certainly.
say, what new services and techniques are Pinehurst Surgical offering in this day and age for folks?
Probably the biggest advancement we've seen in the last decade is going to be robotic surgery.
Okay.
And multiple departments can use the robotic platform to do what they've always done in either a minimally invasive fashion or an open fashion, but now using the robotic platform to help expedite their recovery and help patients return to work faster. So in the operating room, the patient is still there, still asleep on the operating room table. Still use small incisions to gain access to the abdomen.
Okay.
And then the surgeon's actually sitting at a console where there's a 3-dimensional viewer for them to look at what the camera is seeing inside the patient. And then the surgeon's actually able to control 4 instruments at once compared to just 2 with 2-handed instruments, like laparoscopic surgery.
Very interesting. Okay. There's a lot of different entities with Pinehurst Surgical, and so tell me where some different campuses are. So if somebody's watching this video and they live in a certain part of the area, where else can they visit to see some of the docs here?
So our main campus is here in Pinehurst, but we also see patients in Troy and Rockingham, as well as the Rayford campus, and we have the building in Sanford as well.
One of the neat benefits that I found that's very useful here, just as a little add-in, is that the patient portal. If you are a current patient of record, there is a patient portal where you can get your lab results, get your doctor's notes, get all the information that you need without having to make a phone call and wait and play phone tag. So you can always log on and get your patient portal, which I think is really neat.
Well, when patients are here at Pinehurst Surgical, we want them to feel like they're being well taken care of, not only medically, but also we want them to feel like they're in a family-friendly atmosphere,
right?
That they're truly cared for as individuals. And the portal just goes along with that, helping them have access to their information, not only their labs, but some of their pathology reports as well. So it helps expedite communication between provider and patient.
Very good. Dr. Grantham, thank you very much for your
Thank you for your
time today.
Yes, ma'am.
I appreciate it, and we'll see you next time.